One doctor in our area says anxiety and depression are common among COVID patients, but they're also seeing other mental health complications like PTSD, psychosis, and cognitive decline. Health reporter Haley Hernandez joining us now. And Haley, doctors are noticing this in patients who have recovered from COVID-19?
That's right, Christine. So doctors are just now starting to see this one because they say it's a side effect that comes months after recovery. So after that surge in the summer, they're just now starting to see this in patients. And it's not just in elderly people, it's affecting young patients as well.
Lungs, heart, kidneys.
Why it is affecting everywhere, we don't know that, of course.
While the extent of post-COVID side effects aren't yet entirely understood, another alarming trend has come up. About 20 to 25% of patients getting a psychosis diagnosis months after recovery. Dr. Asim Shah, chief of psychiatry at Bentov Hospital, says he sees it in the patients he treats, some only in their 30s, with symptoms ranging from depression and anxiety to
insomnia, psychosis, sometimes even cognitive issues, hand motor coordination issues. Really 20-25% of the people suffer, and we are seeing more and more. In elderly people, we see memory issues.
It's important to seek help if you feel any of these, which is getting easier as we get deeper into the pandemic. Some hospitals have post-COVID clinics.
Post-COVID clinics are basically a clinic with multidisciplinary team, meaning you have a psychiatrist, you have a nephrologist, you have a cardiologist, you may have a rheumatologist, you may have a pulmonologist. So you have all those things.
When should you go to one of these clinics?
Once you are discharged, and if you see any new onset symptom, whether it is pain in your hands, issues with your kidney, heart, neurological, depression, anxiety, memory issues, some motor coordination issues, please see initially your primary care doctor.
Yeah, so from there, your primary care doctor can either help you treat the problem or refer you on to one of these clinics. Now, some health professionals might tell you that a hospital stay or a medication can create these kinds of psychosis events. And Dr. Asim Shah says that that is true, that steroids, the main type of treatment for coronavirus right now, can cause a psychotic episode. However, he says it typically happens while you're taking the steroid or a few days after. Guys, they are seeing this in patients who have recovered 3, 4, even 5 months ago.
And Haley, curious, do the 20 to 25% of patients who get this psychosis diagnosis have a previous history of mental health issues?
No, and actually that's one of the biggest mysteries right now. That's why they're really starting to pay attention to what is happening in the young patients who have no prior history of mental health issues. I mean, it is important to remember that 80% of people do not experience these symptoms, but that's why doctors want to really figure out who is getting it and why this is popping up.
Yeah, 20-25% certainly a troubling number. All right.